Hello, podcast listeners. Welcome to today's CAHL podcast. The California Association of Healthcare Leaders, otherwise known as CAHL, is an independent chapter for the Northern and Central California region, chartered by the American College of Healthcare Executives, or ACHE. CAHL serves healthcare executives in 50 of California's 58 counties. Our vision is to be the premier professional society for healthcare leaders in our region, advancing healthcare excellence and healthcare leadership, and improving the lives of the communities we serve. These podcast episodes are meant to provide thought leadership on numerous healthcare topics from our CAHL members and their allies. Today, we welcome Dr. Tyler Hill, who's the Chief Medical Officer at Sierra Nevada Memorial Hospital, located in Grass Valley, California, in Nevada County, and part of Commonspirit Health. He joined CAHL in 2022. He's an emergency medicine physician, continues to work shifts in the emergency department, and has been with Sierra Nevada Memorial Hospital since August of 2022. Dr. Hill did his emergency medicine residency in Marietta, Ohio, and he spent 6 years there as a medical director of emergency and urgent care services, and was also the physician executive over medical specialties. Welcome, Dr. Hill.
Hey, thank you for having me.
So Dr. Hill, we're here to talk to different leaders about what does it mean to be an authentic leader? And so how would you define authenticity in the context of healthcare leadership, particularly as a physician? And why do you think it's important?
I think authenticity, especially when we're talking in the realm of healthcare and leadership, it's knowing exactly who you are and what your personal values are and not deviating from those. It's being confident in those things. And to me, when you're confident, it allows authenticity, it allows humility to be that much more natural and easy for you.
I would imagine, Dr. Hill, could be incredibly difficult to be authentic leader, especially in an emergency room department where you have such a diverse group of people that are coming under a tremendous amount of stress and fear and anxiety. And how do you provide your true self in that when people want you to possibly even be something else?
We have a lot of algorithms in emergency medicine, and so going through your training, you're taught to always go back to that algorithm, which is the staple of the way you manage critical situations. So when there are times of stress, when you're fatigued, in emergency medicine, we sometimes work 24-hour shifts in critical access emergency departments. You may get a nap here and there, but definitely fatigue sets in. You're woken up in the middle of the night. Maybe you were sleeping and you get woken up, or you've worked a long shift already, or you're working in the midst of the pandemic. But being able to go back to those core values, which in emergency medicine is your algorithm. So I definitely use that as a kind of a consistent comparison. Algorithms are your core values as a practicing clinician. So in leadership, being authentic, being true to yourself, knowing exactly what your core values are, that's your North Star.
So give me an example of either when you were in Ohio or here in California, where you were able to bring your authenticity to the forefront, where maybe you felt like people wanted you to compromise your authenticity and you weren't going to do that. And share with us a personal example of that.
Yeah, I look back to the pandemic for a lot of my leadership lessons and the challenges that came with that. The pandemic for me, especially being an emergency department leader at the time, was a daily example of all of these things that we're talking about. Early on, for me, it was remaining calm with my communication style. While I was under the most intense stress I had ever been under in my life, and really helping manage my team's emotions through that while not taking a lot of their responses or their actions personal. And I remember listening to a lot of leadership podcasts about the natural human responses and tendency during times of stress. And sometimes individuals' responses to stressful situations is not always rational, and that was very valuable to me as I communicated with my team, was better able to understand what they were going through and helping to manage those emotional responses. Early on in the pandemic, our hospital was strained financially, to say the least. There was a significant reduction in volumes in all areas, especially surgical volumes. So those elective cases that were non-critical, non-life threatening, were taken off the schedule. Delayed. And I had to reduce the number of shifts that many of the physicians in my group were working, just because the volume was cut in half essentially. So we just didn't need that many physicians there at the time. And so what I did was I tried to give up as many of my shifts to ensure that for the greater good of the group, they had enough shifts to continue to make a living, to not suffer as significant of a loss of income. And so I think that made a big difference as far as who they saw in me and what I was willing to do for the greater good of my team. And then I look back in the very first few days of the pandemic, there was just so many phone calls, text messages, emails, just rapid fire, and being able to respond with kindness and thoughtfulness, but being able to make decisions in a timely manner. That was crucial. And I think as we went throughout the pandemic, people continued to just watch and wait for me and other leaders to blow up, self-destruct, whatever you want to call it, but being able to remain consistent throughout that time and how I responded thoughtfully, with kindness and so forth, was imperative for the success of the organization, but how they continued to see me as a leader. It was draining, but it was absolutely imperative that I stuck with that. And it really permeated throughout the organization. I had a lot of interactions with departments that I hadn't had much interaction before. And I didn't have the time to build those long-standing connections and relationships that I did with my own team. My team was able to trust me and already knew who I was, so that made the journey throughout the pandemic that much easier. But when you're forging relationships on the fly through a challenging time period, it's a little bit different how that goes. So it was a constant challenge. But again, the pandemic taught me so many lessons, putting me under the microscope, kind of the forging through fire type of example there.
Dr. Hill, so often as physicians are going through medical school and through the residency training, they're taught phenomenal clinical skills, but they're not necessarily taught leadership skills. What are, as you've developed your leadership skills, what do you think are some of the challenges that you've encountered in working with other physicians that are good clinicians but aren't necessarily good leaders?
I think a lot of the times it's emotional intelligence, it's communication. Throughout our physician training, throughout the journey, the training is very regimented. And you almost feel like robots in a sense of having the textbook training beat into you, that you have to be knowledge based, you have to grasp the fundamentals of it, and that is absolutely true and very, very, very important. But in a sense, along the way, you start to lose some of that EQ as you build that IQ, and it's so important for physicians to be reminded of that emotional intelligence, that communication ability plays as much, if not more, of an impact in patient outcomes and your departmental outcomes, the relationships that you have around you. It is so important to never forget how important emotional intelligence and high quality communication is.
I've worked at some large healthcare systems that have been very focused in on quality and safety, and being able to stand up and step out when they see something that isn't right, but then also that fear of in speaking up and speaking out that you may have repercussions, you may get in trouble, you may get fired for some of the things that you're doing. How do you think, as people want to be true to themselves as well as to be an authentic leader, how do you think that this resonates for individuals that are wanting to um, change the status quo, really work on improving quality and safety, and many of the things that highly reliable organizations are striving to be able to do today?
It definitely comes down to creating a psychologically safe culture, a work environment that puts those pieces at the forefront that you were mentioning. You mentioned the quality and safety department. As chief medical officer, that's one of the departments that I work closely with, is our quality and safety team. And then being an HRO hospital, those are all critical aspects of engaging individuals to speak up, to empower them to speak up whenever they see something that's of concern. We do various things to highlight that's important to us. We do what's called good catch awards for those that maybe caught something before it happened, identified an incorrect order and spoke up. Pharmacist or a pharmacy tech that identified something in the electronic medical record, or maybe a nurse on the floor or a tech, something along the way. They spoke up and it was a good catch. It prevented an error. So I think, when you call excuse me, when you call attention to some of those things, it really impacts the entire atmosphere of going, the hospital values this type of environment, this type of culture. And they tend to gravitate towards that type of mindset and feel empowered to speak up.
You've, as you talk about having responsibility and overseeing quality or safety, and knowing that that's everyone's job, that as you look at an industry that's constantly changing, how do you stay true to your leadership style while adapting to all these evolving healthcare landscapes and changes that are happening? I mean, there's not a healthcare organization out there that's not talking about significant changes that they're going through post-pandemic. And so how do you stay authentic with some of the changes that you may not necessarily agree with?
I love this question. And to me, this is probably the most exciting part of leadership, because we were talking about some of the core components of who you are as a leader. And to me, I have my foundational qualities that I absolutely identify as the bedrock of who I am, what I stand for, and who I am as a leader. And those won't change. Those lasted through the pandemic. They'll last through any storm, through the challenges, and even as the healthcare landscape continues to evolve. But there is this balancing with needing to be flexible, keeping an open mind, thinking creatively. It's all what's so fun about leadership in healthcare. And this is my opinion, but I believe healthcare is the most difficult industry in which to be a leader. Especially coming off the heels of the pandemic. And to me, I love the challenge of knowing that it's never going to stop. The challenges, the financial pressure, the evolution in evidence-based medicine, the equipment, the need to pivot to more telehealth versus hospital at home versus focusing on this metric, and evidence coming out about this metric and how we were doing it all wrong. None of that's going to stop. I'm always going to be learning and pushing myself to be my absolute best. And that's motivation to me.
You inspire me, Dr. Hill, and give us a lot of hope in this area. How do you bring that hope to the team that you work with, so that they espouse and support you? Because again, we can't be an island in and of ourselves, that we're only as strong as the team that we have within our organization. So how do you bring about some of that authenticity and the leadership approach that you're talking about with the teams that you work with?
Yeah, I think, I would describe that as modeling the way, being consistent, showing up to work each and every day, being consistent to those values. And, I ask myself each and every day, what are those values that those around me want and look up to and desire in a leader? And if you look at a mound of evidence from a research team, it's called the Leadership Challenge, with decades of evidence. They talk about 4 key characteristics of leaders. Number 1 is an honest leader. Number 2 is a competent leader. Number 3 is inspiring. You just used that word. Number 3 is an inspiring leader. And number 4 is a forward thinking leader. And so to me, that is what I wake up and strive to be each and every day. I think the first 2, you're not a leader if you're not honest and you're not competent at what you do. The other 2 are elevating what type of leader you are, but starting with those first 2, being honest and being competent at what you do, there is no leadership without followership. So you have to have those 2 key components before anyone gets behind you and says, I align with where you're going, the direction that you envision for this hospital or for, this business or this industry. But those 2 are key components. And then the other 2, as you move on, I think of inspiration as being a coach, very athletic minded. My mind often compares healthcare to athletics in a lot of ways. And as a leader in healthcare, I see myself as a coach in a lot of ways, inspiring your team when times are difficult, when the financials aren't looking great, or perhaps your quality and safety ratings, what we were just talking about, perhaps they're not where they need to be or where they should be. It's imperative that you can take your team to a place that they feel inspired and share that same vision that's worthy, exciting, meaningful, all those things that they get jazzed about coming to work for each and every day.
Dr. Hill, one of the with our podcast listeners, you and I can see each other, and they can't. And in Dr. Hill's office, he has some artwork from some children, assuming that he's a parent. And so I wanted to ask, how do you bring some of that leadership and commitment to the passion that you bring to your work? How do you bring that to your family so that they can learn from you as well as you can learn from them as well?
Man, that's probably the toughest question of all. I have 3 wonderful children. My wife and I are so blessed, and yeah, I have a lot of artwork. They make sure whenever they send me to work with a new picture that I take a picture with my phone and send it to them to show them that I actually put it up on my wall. But I think being a leader and continuing to grow and evolve and educate myself by listening to podcasts, reading, listening to other great mentors who've come before me. I think all of those key pieces help me to be a better parent, quite honestly. I think being a parent is tougher than being a healthcare leader. Going home and when my filter may already be at its lowest after a long day at the office and having tough conversations or challenging interactions, and then going home and knowing that my kids need me to be at my best and patient and to listen and to help foster them in an environment of which I can be proud of one day. I mean, that's the true goal to me. So constantly being able to reflect and to be my best when I go home is top of my radar. I'm far from perfect, and it's often a different communication style that I have when I go home. I'm often less patient. My voice gets louder than I ever do here at the office, and I tend to not listen nearly enough as a parent, but it definitely keeps me on my toes and continues to push me to be even better for them as I try to be a better healthcare leader as well.
Dr. Hill, I just wanted to thank you for providing your feedback and your insights and perspectives. This does conclude our CAHL podcast for today. We hope you've enjoyed this inaugural event, and we have plans to continue providing thought-provoking insight from healthcare leaders throughout CAHL's geography. We hope you learn something new every day, that you have an opportunity to make a difference, and you're kind in the work that you do.